How to stop bloating. Quick tips to get rid of bloating. Bloating usually happens when excess gas builds up in the stomach or intestines. When bloating occurs right after a meal, it usually resolves itself, but it's often possible to speed up this process. The best way to tackle bloating is to determine its cause. Common triggers for bloating include digestive issues, constipation, food allergies, and intolerances can lead to bloating. When stool becomes backed up in the large bowel, it can cause bloating and a feeling of discomfort. Excess gas may also build up behind the stool, making the bloating worse. Diet, fizzy drinks, too much salt or sugar, not enough fiber in your diet can cause bloating. Hormonal changes. Many people experience bloating before and during their periods due to hormonal changes and water retention. Many home remedies can help to manage the pain and discomfort of bloating. The following quick tips may help to get rid of bloating, a bloated belly quickly. So 1, go for a walk. Physical activity can get the bowels moving more regularly, which can help to release excess gas and stool. Getting the bowels to move is especially important if a person is feeling constipated. A walk around the block can provide fast relief from gas pressure. 2, try yoga poses. Certain yoga poses can position the muscles in the abdomen in a way that can encourage the release of extra gas in the GI tract. This can help reduce bloating. 3, use peppermint capsules. Peppermint oil capsules may also be helpful for ingestion and related gas. Manufacturers usually market them as a treatment for the symptoms of irritable bowel syndrome, but people without IBS can also use them to relieve bloating. Peppermint works by relaxing the intestines muscles, which allows gas and stool to move along more effectively. People should always follow the instructions on the packet. Anyone who is prone to heartburn may need to avoid peppermint. Peppermint capsules are now available to buy over the counter at drugstores or online. You can also try gas relief capsules. So they have simimethicone pills and liquids are anti-gas medications that can help to move excess air out of the digestive tract. It is essential to always take medication according to the instructions on the label. People can find gas relievers in drugstores or online. 5, try abdominal massagers. Massaging the abdomen can help to get the bowels moving. A massage that follows the path of the large intestines is especially helpful. People can follow the steps below to do this. So placing the hands just above the right hip bone, rubbing in a circular motion with the light pressure up towards the right side of the rib cage, rubbing straight across the upper belly area toward the left rib cage, moving slowly down toward the left hip bone, repeating as necessary. If the massage causes any pain, it is best to discontinue it immediately. You can also use essential oils. A study found 2016 tested the effectiveness of supplements containing a combination of fennel and curcumin essential oil in 116 people with mild to moderate IBS. After 30 days, people reported an improvement in their IBS symptoms, including bloating and abdominal pain. People should not consume essential oils without speaking to their doctor first. This is because some formulations may be toxic and can interfere with medications, and there is no regulation of dosage. 7, take a warm bath, soaking and relaxing. The heat of the bath can provide relief for the sore abdomen. Relaxation can reduce stress levels, which may allow the GI tract to function more effectively and help reducing bloating. So, some long-term solutions for bloating. Quick fixes are not always effective for some causes of bloating. However, people who have frequent bloating may find that certain lifestyle changes can tackle the cause and reduction over time. So 8 would be increase fiber gradually. Eating more fiber helps to prevent constipation and bloating. Most people in America do not get enough fiber, with only 5% of people meeting their recommended daily fiber intake of 25 grams for females and 38 for males. However, it is important to bear in mind that eating too much fiber or increasing fiber intake too quickly can cause even more gas or bloating. People may notice adverse effects from eating more than 70 grams of fiber a day. So it is best to start slowly and increase over several weeks to allow the body to adjust to this change in diet. Replace sodas with water. Fizzy carbonated drinks contain gas that can build up in the stomach. The carbon dioxide that makes soda and similar beverages fizzy can cause a lot of bubbling and bloating in the stomach. 10. Avoid chewing gum. The sugar alcohols in gum can cause bloating in some people. Swallowing air while chewing may also lead to bloating and gas pain. 11. Get more active every day. Exercise helps body move stool and gas out of the colon and may make bowel movements more regular. Exercise also releases extra sodium from the body through sweating, which can help to relieve water retention. So it is vital to drink plenty of water before and after exercising to stay hydrated, as dehydration can make constipation worse. 12. Eat at regular intervals. Many people experiencing bloating directly after a big meal. It is possible to avoid this by eating several smaller meals each day, which can help to keep the digestive system moving. 13. Try probiotics. Probiotics are good bacteria that live in the intestines. Taking a probiotic supplement may help to regulate the colon bacteria that can produce gas and cause bloating. 14. Cut down on salt. An excess of sodium causes the body to retain water. This can cause the swollen or bloated feeling in the belly and other areas of the body, such as the hands and feet. 15. It's always good to rule out any medical conditions. In some cases, bloated may result from a medical condition. To get rid of this bloating, a person may need help from a doctor to diagnose and manage their condition. So it talks about here underneath 15, some of the conditions that can arise with bloating. And then it also says considered a low FODMAP diet. FODMAPs are a type of carbohydrate that occurs in many different foods. A 2012 review article of multiple studies concluded that a low FODMAP diet might improve symptoms in at least 74% of people with IBS. Typical symptoms include bloating, fat flatulence, and abdominal pain. You can also keep a food diary. Food intolerances are responsible for many cases of bloating. They can lead to excessive gas in the digestive tract. Bloating is common in people who have lactose intolerance and are unable to digest the lactose sugar in dairy products. Autoimmune intolerance to gluten, known as celiac disease, is another potential culprit. For people whose bloating happens after meals, keeping a food and drink intake for several weeks should help determine whether specific foods are responsible. And this is just, I have a simple template, so time, food, quantity, mood. 18. Look at supplements and medications. Some supplements, such as iron, can cause constipation and other symptoms of indigestion. This can increase bloating. Although it is not common, bloating and swelling of the abdomen can signify a severe medical condition. Liver disease, inflammatory bowel disease, heart failure, kidney problems, and some types of cancer can cause bloating. Bloating that continues for days or weeks may indicate a health issue that needs medical attention. It is advisable to speak to a doctor about ongoing bloating that does not go away over time. So people should seek bloating occurs alongside these symptoms should seek medical advice. So appetite changes, diarrhea, vomiting, weight loss, fever, severe abdominal pain, bright red blood in the stool, black or brown, dark brown, maroon stools. Ultimately, the outlook for bloating depends on the underlying cause. Most of the time, bloating is due to minor issues that lifestyle changes or over-the-counter treatments can resolve. People should see a doctor if bloating is ongoing or occurs with other symptoms. Determining the underlying cause of bloating and other digestive issues is the first step to getting treatment. and feeling better. So that's it for this video. Thank you for listening.